So male patient, middle-aged, I think it's fair to say.
Yeah.
And you are, I think when the camera comes around, we will see you using a cannula, will we? Yeah. Yes, we will. So why did you choose to use a cannula instead of a needle in this case?
Yeah, so once again, it's just from, first of all, safety perspective. We've got the superficial temporal artery that comes around here. Very important vessel. Also, so the main thing is from a safety perspective, we don't want to occlude vessels. And then also with the temples, because it's quite a large area, the cannula really helps to spread that filler over a large area. So yeah, here you can see I'm pretty much, I'm in the superficial fat.
Yeah. Just under the skin.
That's right. And you haven't seen what I did at the beginning, but what I do is I insert the needle. Sometimes I do inject a little bit of local anesthetic there as well. So like a bit of lidocaine 1%, just to make it completely numb, because it can be sore. There's a lot of fascia in the area. After that, then before I start injecting anything, I'm actually just moving the cannula around in that superficial fat.
Without releasing filler?
Without releasing filler, yeah.
Just to make space, I'm guessing.
That's it. I'm just opening up potential space. And then once it's opened up, then I can start to deposit the filler there. How do you feel? What would you do this?
Sometimes I've done that in the past.
Yeah.
I've done that in the past. I think it depends on the individual. But I completely get that. Because sometimes if you go under the skin, he's looking at himself in the phone. So to be fair, that shows how not painful it is.
Yeah.
He's actually doing a selfie while it's happening.
But he is a pretty brave guy. He's got a very high pain tolerance.
Nice. I think sometimes in the temple, the risk is if you just put the cannula under the skin and you do a few lines of filler that's released, when you finish and you look at it, you've got lines of filler.
Yeah.
Not a smooth spread over everywhere. And that's why if you go in and do the cannula moving first and just separate the skin from the initial layer, then the filler will just spread much more nicely. Yeah. However, I do have to say that the cases in the past in my career where when I have had a little bit of a streak, it's never stayed that way. And it just massages itself out because we've got the temporalis muscle. So when we clench, we can feel here.
What kind of filler would you use here?
I would probably look at different fillers based on the layers.
Okay.
So as we know, there's multiple places you can place filler in the temple. What you're doing here, and even on the other side here, is the most superficial high up layer. You're just under the skin. Yeah. I believe, we both know there's that layer, and then there's deep as possible.
Yeah. So gunshot technique.
Yeah. We call it a gunshot. Not very well named.
Sounds pretty scary.
Yeah, but it's just a standard technique now. It's from the Arthur Swift paper. I've forgotten the name, the year, unfortunately. I'm going to get some hate for that in the comments. But that's where it's from. And I believe there's another area we can use. So we've got high up as possible, deep as possible. And then just below that high up, we've got the interfascial space as well, which I think is a little bit smoother because of what we got there.
Yeah.
So if I'm going deep down, I will look at something like Revanesse shape. The equivalent in the intraline range would be what you're using, the M4.
Actually, this one is M3.
M3, yeah. Okay. Oh, as in, if it were going deep down. It would
be right. M4. Yeah. So like gunshot, you would use something hard.
Yes, exactly.
Yeah, me too.
And then if I was using this technique just under the skin, I would probably look at something, depending on the depth, something along the lines of Revanesse Ultra or Outline, something like that.
Okay.
If I was going interfascial, again, probably something like Revanesse Outline.
Okay, right. Yeah. So you're looking more like mediums as well?
Yeah, roughly speaking.
Yeah.
And I think what we'll do, we'll have a look at the before and after of this, because I think that's quite interesting, so people understand why we do temples.
Yeah.
Because a lot of patients think, well, I don't care about my temples. Lips are what people look at, cheeks are what, cheeks, jawlines, that's that model look.
Yeah.
But like you said earlier in this episode, temples can age you, the hollowness. And if you do cheeks without looking at temples, you're going to make yourself look older. Right?
Exactly, yeah.
And I think what people need to study in the mirror is when you look straight as possible, the widest point in your face should be here, the maximum projection of the cheeks. From there, it tapers inwards a bit to the temples and inwards a bit to the jawline. Not going to get into technical details, but to some extent. And it's not necessarily the same taper. But if you have a certain taper to the temples, and then you extend the cheeks even more, and you go here, Now that taper looks bigger. That is what Aaron said earlier can aid you. And I was standing from behind the patient. It looks like you're doing something to his head, like polishing it, but you're not doing that, are you?
So what I'm doing, I'm looking. You'll see me coming from bird's eye view quite
behind,
a lot.
yeah.
Especially when I'm looking at temples, even cheeks. When I'm doing anterior cheek, I'll look from above to see
Yeah.
if they're balanced, and then especially chins.
Yeah.
So I look down always.
And I think that allows you to see the relative asymmetry and symmetry, right?
That's it, exactly.
For me, the difficulty with that is promising symmetry.
Yeah.
And I find, especially with a dental background, that this muscle, the temporalis here, as well as the clenching muscle master, 2 of the 4 muscles we use to chew. And if this is asymmetrical, or becomes asymmetrical as we age, and it can, based on the teeth, then it might make the face look slightly asymmetrical here. So I find older patients tend to need more on one side than the other.
Yeah.
Temple filler. Do you find similar?
Definitely. Not even temples. I would say pretty much every compartment. Yeah.
Agree.
And it not only from sort of like the dentition point, also from like
Just
people, the
aging.
way, also the way people sleep as well.
Yeah.
I find that whenever they sleep on one side,
Yeah.
that side is the one that tends to get more volume loss.
Yeah. And do you massage?
This,
like this?
definitely. Temples are the one area I always massage.
Okay.
And what I do is I kind of sweep upwards.
Yeah.
And what I do, the role of it is so that I can get rid of the blood in the veins.
Sure.
And once I've sort of massaged out the blood from the veins, I can see what is actually filler. Because whilst I'm doing that, the veins, they tend to get very irritated. They kind of get inflamed. And it's hard to see what is vein and what is a streak of filler.
Yeah. Another one technique I use for this particular area, if I'm using that particular layer like you were using there, I'll put my cannula in as far as it's going to go. Before I've actually released the filler, beyond the end of the cannula, I'm actually going to put my thumb down. And then when I start to release filler, the thumb tracks as well, but not in a slide, in a like this motion. So my cannula is coming back and my thumb is doing this. Sliding. So it's massaged as soon as it's come out of the cannula.
Yeah, it's a great technique. I've tried this before. Yeah, very good.
It works brilliantly, doesn't it? And you never ever, like when I'm finished, I'll massage as it's coming out, do it everywhere. And I pull the cannula out, I've got no massage to do.
Yeah.
You just can't see a streak or a line anywhere.
It's true.
And that's why, that's the point when I stopped actually putting the cannula in first and making space.
Yeah.
I just do that and I don't need it. Because I find also, when I'm teaching, and obviously we both teach things like this, what I find is when people see that technique of opening up the space with the cannula, sometimes they're too aggressive. And they hit a blood vessel and they cause a hematoma, a massive swelling of blood. So I'm personally someone who prefers to teach that technique to more experienced injectors who want to learn something new. I try and keep it away from the new injectors, and I teach that instant massage post-release rather than the other one.
True. Yeah, I suppose, for quite a newbie, having a massive hematoma like that,
it puts you off.
That's it. It can be disheartening for them. Yeah.
And now he's looking in the mirror and watching you do at the same time. And interestingly, he's now sat upright as well.
Yeah.
I think personally for the temple, being flat or being sat upright doesn't make too much difference to the result. I think it's more just for comfort.
Yeah. It's me just sort of getting them up and seeing how do they look overall.
Yeah.
That's it.
Exactly. Same. Whereas I think if you're doing something like tear trough, lying down actually helps the movement of the filler.
Yeah.
And it does make a difference to the result.
True.
Whereas this, I think, is not necessarily the case. And how long have we got left on this one? It's finished. That's why it's not moving. So I want to see the before and after on this because I think it looks. I have seen this before. I think it's that one, right?
That's the one. Yeah. So this one, there's more than temple done here.
Yeah.
So you can see
what a difference.
Big difference in the mid face.
He's just got this brightness.
Yeah.
Because the light is catching his face now. It's not creating shadows everywhere.
Exactly.
And what I would like people to look at is the work Aaron's done. If you look at the edge of the brow and then immediately to the side, you can see that there's like a cave in. Yeah.
Yeah.
And now you don't see that.
That's it.
And we take
Yeah.
that for granted when we're younger.
Yeah.
I
yeah.
think. So always pay attention, and he looks so much younger.
Yeah.
He-
So,
he's-
so apart from the temples, I mean, temples are only a small fraction of the work, but
yeah,
there's also forehead filler here.
yeah. You can see the
So,
11s lines.
it. Yeah.
that's gone down massively.
Also got anterior cheek. So there's quite a lot of volume in the anterior cheek there.
How many mils are we talking for this whole before and after?
This is around
Probably 5 to
10,
10.
12.
10 to 12
10,
mil.
12, yeah.
Yeah.
Actually, because, when this gent came in, he had such severe volume loss in the anterior cheek.
Yeah,
The first time I saw him, it was just the whole treatment was focused on that.
right.
And actually, I got really excited, to be honest, because he came in and he told me, his under eyes are bothering him. And I already had like an amazing vision in my head for him. But then he said, okay, I think I'm going to go home and think about it. And I was like, oh, shit.
Yeah.
Then he called me about 10 minutes later. His wife said, get back there and have it done. So I came back and I was honestly so glad.
Yeah.
It was such an excellent result.
Not just us, but many people in our job, we would look at his before and think, oh, I can't wait to inject that. He's
Yeah,
going to look
yeah.
so good. Like you just know certain people are going to look fantastic, right?
Yeah, yeah.
And you take so many. He's always trying holding back a smile.
Yeah.
In the after, whereas he just looks miserable because he's so unhappy that his wife's told him off in the before. But that's a really good result. So, in terms of the cheek, just in this section alone, I suspect that alone is going to be what, 3 mil
More.
more. Yeah,
This is about, in the mid face, this is about 5 mils.
5 mil just
5
in the
mils.
mid face.
Yeah.
Wow.
Yeah.
Wow. And I'm not even surprised. If you were to add any more, would you?
Yeah.
And where?
So I would say, well, actually, I'm going to see this gent later on in the year.
Yeah.
So one thing I will get into soon is endolift.
Yeah.
So another thing that does bother this client is neck. So he's got some laxity down here, a little bit of volume loss around the jawline. So we're going to do a bit of endolift, start tightening up the structures in the neck and
It's a
around the
device.
jawline.
It's like a radio frequency device for skin
Yeah, sorry.
tightening.
Exactly, yeah. So endolift is just it's like a fiber with a laser at the end.
Yeah.
It passes through the fat and it basically causes a bit of liposuction and it also tightens up the skin and soft tissues as well. So we're going to do a bit of that. And then one thing I will do in the future is to just start, after all these structures are tightened up, is start building a little bit more structure back into his jawline.
Yeah, sure. I think potentially even the transition from the chin to the jaw, because he's got a slight dip here.
Yes,
And I think it's quite common, to be fair. A lot of people have it.
Yeah.
And I think straightening that up would look pretty good as well. And I'm possibly going to be a little bit controversial here, not to you, but to the viewers, and say potentially a bit of lip filler.
Yeah. I did suggest it,
Okay.
but not too keen on it at the moment.
I thought so. But do you know what? More and more men are having them.
Oh yeah, for sure.
And it gives them a lot of age back.
Yeah.
Because you can see the lip now.
Definitely, yeah.
And that's a big thing. And I would say, don't be afraid. You go to someone who has done it thousands of times, like either of us. We can do it like no one knows you've had lip filler.
That's it.
And
I think it's just like when you have very manly men,
yeah,
they're not
Just the thought of it,
Just
right?
the thought of lip filler is already putting them off.
yeah, absolutely. And I think that so 10 to 12 mil total.
Yeah.
What time period are we talking? Was that one session?
So this was over 2. So the first session was mid-face, under eyes, and I think nasolabial lines.
Okay.
Second session was temples, and also you might just notice labiomental crease as well.
Which is this one here.
Yeah.
2 sessions. That's pretty good.
Yeah.
That's pretty good. And then what kind of cost are we talking for something along these lines?
So this, looking about 3,000 for this.
3,000.
So
To
10
be
mils,
fair, for 10 to 12 mils,
Yeah.
for that kind of result, I mean, that's pretty decent. You're spending probably more than that for multiple sessions of lasers and skincare and all these things.
Exactly, yeah.
And actually, you do things in 2 sessions, instantaneous at the end of both those sessions to see the result, isn't it?
Exactly, yeah.
What would you do to further improve the result here? In terms of non-filler,
Non-filler.
if anything.
So one thing this client does come back for is just regular Botox.
Okay.
Just to maintain the sort of forehead area.
Yeah.
Of course, medical grade skincare.
Yeah.
I do want to start him on like a retinoid.
Yeah.
And then, like I said, we're gonna start getting into a little bit more energy devices, endolift to start with.
Yeah.
That's it. That's about it, really.
Sure. I think potentially I
What would you do? Sorry.
What would I do? Skincare I would go for as well.
Yeah.
Go for something like that. I would probably also look at some kind of, if he's worried about this, I would look at some kind of coring laser, like an ultra clear.
All right. Yeah. Yeah.
I don't know if you've heard of those ones.
Yeah. Yeah.
And that's probably going to be really, really good.
Cold laser or something.
Ultra clear.
Ultra clear. Yeah.
Yeah. So basically, you're taking a corkscrew into the skin, pulling out a column of skin, and then it just squeezes everything together.
Yeah.
So you're shrinking the face essentially without doing a facelift. I'll probably look at something like that. I think the skin looks a little bit worn as well, without wishing to sound disrespectful, but I think it does. I would look at something along the lines of microneedling. I would instigate home care in terms of microneedling alongside skincare like tretinoin as well. And I would also bring in regular LED treatment again at home, so we can do it much more often and go from there. And I would also inject quite a lot of Sunakos around the eyes. I think that the last remaining texture under the eyes, I think, can go pretty easily with the Sunakos.
Yeah.
And I think potentially around the mid-face, so around here, a little bit more room, I think, for some filler.
Yeah.
If you look on the right of the picture, around here, there's still a dent.
Yeah. Yeah. That's one thing I did struggle with, actually, because with this client, it did have quite a prominent malar bag at the beginning.
Yeah, you can
the
see
malar
it.
area is quite prominent. So even after doing the deep periosteal injections, it was still not quite there.
Okay.
So I did something a little bit off-label, kind of came superficially with a dense filler.
Yeah.
And just deposited a little bit just below the malar area.
Yeah.
That really helped because obviously, talking about sort of the, how much of the filler you can see, like this, what do you call it? The surface.
Surface volume coefficient.
Yeah, surface volume coefficient. Bringing the dense filler more superficially is better use of it, even though it's not particularly the safest.
Yeah.
But aspirating and getting the filler into that part there, you get more bang for your buck.
Yeah.
So
that's essentially what surface volume coefficient is. Bang for your buck.
That's it. Yeah.
If you inject a certain amount of filler, how much projection are you going to see? And that's what it means. Places like this, a very small distance from skin to the bone is going to be very high because it will project very quickly. Places like the lip, etc. Deep in the temple, you've got to inject a lot to see any visual difference on the surface. And that's what SVC measures, which is different to everyone, but we have a rough guide for the face as a whole. Other than that, I don't think there's a huge amount I would do personally. I think he looks fantastic. I just look at personal preferences beyond that.
Yeah.
Not a whole lot else. That's a really, really phenomenal case.
Cheers.
When he comes back later in the year, what's your plan for him then?
So first thing on the cards, endolift. He's already happy.
Oh, so he's going to sign up for that?
Yeah, okay. Yeah. He's ready for it. We should have it around January.
So you've already...
We're in the process.
We're in the deposit down.
We're not that far, but
okay.
we're. I mean, I wanted the device for a while, but
I know. I've tried to convince you against it.
Yeah,
many times.
exactly. But priority this year was kind of getting the clinic up and running, and that's come with its own challenges.
Yeah.
So 1 year later, I think we're finally in the position where I can get back on that train with endolift.
Fine.